Why should someone study Parkinson's disease? Well, Parkinson's disease is a common neurological disorder, and the prevalence of Parkinson's is increasing. Additionally, if you understand Parkinson's, that can help explain the brain's biological role in Parkinson's disease and how it progresses throughout its stages. Parkinson's is increasing globally and is expected to go beyond 14 million cases. Brain areas affected by Parkinson's will be discussed in this presentation, along with numerous current treatment options and the overall disease progression and quality of life issues that are necessary to explain this disease. Understanding the importance of neurotransmitters is key in understanding the Parkinson's disease process. Parkinson's disease has a strong impact on available dopamine levels. Overall, what happens is Parkinson's will lower the levels of dopamine, and what this results is movement disorders, because dopamine has strong potentials that focus on movement, control, gait, and walking. So all of those areas are adversely affected by dopamine levels. Dopamine also has a role to play in attention. So later progression of Parkinson's disease process results in some types of cognitive impairment. The midbrain has the important dopamine pathways in the substantia nigra. Cell bodies send out dopamine and their axons to other areas of the brain. Studies show that at least 50% of neurons are lost before any motor signs or symptoms are presented. So this is important since one of the first signs and symptoms of Parkinson's disease are those motor symptoms. In the early 1900s, early scientists working in pathology labs were able to see color differentiation between samples from Parkinson's disease patients and non-Parkinson's disease patient studies. They basically found that the color differentiation helped highlight the loss of dopamine and certain other neurons in these pathological studies. The basal ganglia are an important area of key nuclei in the forebrain. And what makes this key is it's a key part of the brain's networks that controls voluntarily body movements. Alterations or changes in the basal ganglia will result in disturbance of movement. This can be the first important sign and element of a movement disorder or of Parkinson's disease. The hippocampus and amygdala are additional brain regions that can be affected by late-term Parkinson's disease. Studies have shown cognitive impairment in the hippocampus and amygdala. These areas may age faster in patients with Parkinson's disease process. This leads to at least mild cognitive impairment possibilities. Studies also have shown that late-stage Parkinson's patients, up to 83% of them, have cognitive impairment with these hippocampus and amygdala affected. There are a few different treatment options for patients with Parkinson's. The treatment focuses on loss of dopamine cells in the substantia nigra and can be divided into minor and primary medications. The actions of the early minor medications is to modestly improve dopamine concentration within the midbrain by promoting dopamine release and inhibiting reuptake. Inhibiting reuptake is a common method across many medications to keep more of the neurotransmitter available to the cells in that area of the brain. Primary medications are dopamine antagonists. They provide robust, vast improvement of motor symptoms of Parkinson's. Most patients will require this primary medication within 1 year of diagnosis. Currently, levodopa is the most effective medication, and it's converted within the brain to dopamine. This is very important to consider since many of these patients may require this medication and skip those minor medications altogether. Another treatment option is deep brain stimulation surgery. Deep brain stimulation surgery improves the main symptoms of Parkinson's, including rigidity, bradykinesia, and tremors. This therapy only benefits those patients who respond well with levodopa, and the surgery can result in 50 to 70% reduction in tremors. Understanding who is a good treatment option for deep brain stimulation surgery is critical for that therapy technique. These current treatment therapies can be all beneficial and impactful for the patient, and understanding this is extremely helpful. Recent studies have shown that non-motor symptoms can precede motor symptoms of Parkinson's by more than 5 years in over 20% of patients. This is important for the healthcare team so that way these motor symptoms are correctly diagnosed with Parkinson's and that they are not misdiagnosed. Some of the non-motor symptoms, however, include cognitive decline, mental health issues, sleep disorders, bladder and urinary issues. And these symptoms are often the most troubling experienced by the patients themselves. These non-motor symptoms can have a strong impact on daily quality of life issues. Each one of these symptoms could require both a primary care visit and then referrals and then appointments and additional tests for the specialty visits. This is why it's so important for the primary care team to align with the specialist to take care of all the non-motor symptoms and get treatment for the non-motor symptoms of Parkinson's. Also, depression is the most common mental health mood disorder experienced by Parkinson's patients, with an estimate of over 35%. Again, trying to approach the patient's care plan with both motor and non-motor symptoms together is ideal. One of the main treatment goals is to enhance quality of life for as long as possible for the patient. This is necessary for the patient so that way the patient can stay positive and motivated and engaged with their own treatment care. Towards the latter stages of Parkinson's, 80% of patients will develop difficulty swallowing, also known as dysphagia. Early diagnosis can help improve this quality of life and prevent those complications with dysphagia, and some of those complications can be quite dire, such as aspirational pneumonia, which can lead to end of life for many patients. Getting on the correct treatment plan is necessary for improving the quality of life. Again, accurate and timely diagnosis of Parkinson's disease, along with referrals to specialists to help with non-motor symptoms, is needed.